Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today we are going to talk one important topic, that is the injury over the head. Head injury in the babies, specifically in the infants, toddlers. When you have to go to the hospital immediately, when you can observe the child at home, which are the short term and the long term consequence of the head injury, all those things we will discuss today in this video. Many times what happens that you have kept the baby on the bed, baby will roll, fall down and got the injury over the head. You have kept the baby in your lap, you are sitting on the chair, baby moves suddenly and he will get fell down. Many times other smaller babies, they also carry the baby with them and the child fell down. So whenever there is injury, our main concern is how much is the injury into the head or into the brain, because that decides the child future. If there is a significant brain injury, it might require certain investigations like the CT scan, and maybe sometime it requires the surgeries also. So head injury is a very important topic as far as the children's accidental injuries are concerned. So I will discuss in detail about the head injury, what you can do at home, when you have to go to the hospital immediately without wasting a minute, and when you can just observe the child at home. These are the series of the accidental injuries in the children. One of the video which I have prepared, when the child accidentally ingest, they put the things in the mouth like the coin, magnet, toy, when to go to the hospital. Do see that video also, because that video is also very important, because I am getting lot of comments on that video, and many times I am finding there are serious concern when patients are not able to find it out what is to be done urgently. So watch that video also. So these are basically the accidental injuries and how to take care at home and when to rush to the hospital immediately. Let's begin the video. Friends, whenever child fell down, it is important to know that how the child has fell down, how much height child has the fell down. I will give you example. One child fell down from the from the bed, maybe it is just a 1 foot or 2 foot, and another child who fell down from the first floor. So the injury will be more based on the height. If the child is just playing and fell down, maybe the injury is less. But if the child is running and he fell down, maybe the injury is more. Second thing, on which surface child has fell down. Suppose if it is a grass, when the child is fell down, injury will be the less. But if it is a tile surface, the injury will be the more. Third important thing is how the child has fell down. Whether the child fell down from the back, whether the child fell down from the front, whether the child fell down on the hands, how he fell down. Because the injury will be get decided based on what is the impact, what is the pressure of the injury. When the child fell down, how much impact occurred on the body. In this video, we will mainly focus on the head injury, because that is the most important thing to preserve the brain. So if there is injury in the brain, it might have the deterioration very fast. Now let's take one example, like mother is holding the baby and sitting in the chair. Now child moved suddenly and the child fell down. Now what will be your immediate reaction? What do you want to see into the child? The first and foremost, you will see that how the child behaves, whether child is moving his limbs, crying or not, whether child is absolutely motionless, he fell down and just like this, that must be the significant injury. You have to rush to the hospital immediately. Second important thing, you will observe that how the child is breathing. Many times it is difficult for the parents to apprehend that how the child is breathing. So what you have to do, you just look at the baby's tummy, how the baby's tummy is moving. If the baby's tummy is moving, that means child is breathing. If the baby's tummy is not moving much, that means there is some problem. Go to the hospital immediately. So two important things: see the activity of the child. How is the movement? How is the motion of the child? That is important. Second thing is the breathing, because these two things are very important. They are the vital functions. Like if any child got the brain injury, their child become motionless. So that is very important. Now many times what happened, that once a child fell down, child will have the excessive crying. Excessive crying will be there, nothing to get worried about, because that's how the child perceives the injury. But what happens once you distract him, once you try to console him, is still persistently crying or not? That is very important. Now many times what happens, that any kind of the injuries happen, there might be some wound. Like if you are able to see there is a bleeding wound anywhere over the scalp, immediately go to the hospital. If there is any bleeding from the nose, ear or the mouth, immediately go to the hospital. Another important thing is the injury to the tooth. Like tooth might have avulsed out, might have come out. Take the tooth into the saliva or into the milk, and with the tooth go to the hospital. Sometimes the tooth go inside. That is also one form of the serious injury where we require to see the dentist. Okay, so what are the two important things? One is the activity of the child, second thing is the breathing, third thing which I told is the bleeding from anywhere. Now suppose there is a one open wound here, child fell down and child has a one open wound here, but child's other things are okay. Child is playing well, he cried for a while, then he settled down, there is no vomiting, you didn't see any change in the behavior, then I don't think there is a need to rush to the hospital. You just clean the wound and you can apply any antiseptics. Now another important thing is about the vomiting. If the child is vomiting 2 or more times after the head injury, that is an indication that you have to reach to the hospital immediately and get checked by the emergency doctor. Many times in this type of the situation, CT scan brain is required. I have seen number of times when the child had any injury, the parents come to the hospital and ask for the X-rays. X-rays are not required in any kind of the injury over the head, because what we are interested to know is whether the brain is injured or not. The X-ray will only tells you about the condition of the bone, the skull. It will not tell us anything about the brain injury. So whenever child is fell down, never ask for the X-ray. We have, if it is required, we have to do the CT scan brain, and that is also immediately. Now another important consequences which you have to see when the child is at home and who the child is fell down, whether the child is getting any seizures, fits. What is seizures? Seizures is like the jerky movements of the hands, legs, sometimes the uprolling of the eyeballs, child will become stiff like this. Those all are the seizure, fits. So whenever there is a fits, that is the indication there must be the significant brain injury. So what are the important things which you will keep in the mind? First is how is the activity of the child. Second thing, whether child is breathing or not. Third thing, whether child is bleeding and how much is the bleeding, whether you can control it at home or not. If you are not able to control it at home, go to the hospital immediately. If the child is bleeding from anywhere else like the ear, nose, ear, mouth, immediately go to the hospital. Vomiting, 2 or more vomiting, you have to go to the hospital immediately. And any kind of the convulsive seizures, fits movement, immediately you have to go to the hospital. Now what happens, that obviously the brain is a vital organ and any injury to brain needs to be tackled very fast. So if the child has fell down and hit his head, and if there is any bleeding inside the skull, that will compress over the brain and the brain function will start deteriorating. In that case, you need the help of the neurosurgeon. Neurosurgeon are the surgeon who deal with the brain surgeries. If there is no bleeding and the pressure is not much inside the skull, then maybe only the neurophysician or even the pediatrician will take care. Now many times what happens, there are multiple trauma, like the child might have met any accidents on the road. Parents are going on the bike, baby was on the back side and baby fell down, then we don't know that what kind of the injuries will be there. After the brain, another important area is abdomen, because abdomen is a open kind of the cavity, and if there is any bleeding inside the abdomen, it requires definite surgery. And if there is injury happened over the liver or the spleen, very rapid deterioration, child will start deteriorating very fast, it will worsens very fast, and many times immediate pediatric surgeon will intervene and will ask you for the surgeries. Third important organs which are getting involved are the bones. Many times there are the fractures of the bone. Common fractures are the arm bone, that is known as humerus, this radius, and the ulna bone. Then the thigh bone are the common to cause the fractures in the children. So whenever child hit his head or got the injuries, first and foremost we have to look for the anything related to the brain. Second thing is about the abdomen. Third thing overall for the body, for the brain. So this is the, in the nutshell, I have given you the background, what you can do at home and when to go to the hospital immediately. Suppose if the child fell down, multiple trauma is there, and if you are suspecting that there might be some injury over the neck here, then you can restrict the movement of the neck. That is important as far as you can do. Like the many times in the children it is not possible to restrict the movement. What you can do, you can put one rod or the wooden material here so that child will not move his head. You can tie with the thread so that child will not move the head. So you can restrict the movement of the head. If any cervical collar kind of the thing is available, or maybe the thick muffler is available, you can do that one. Now, which are the age group when the injuries, accidental fall is most common? Mainly in the infants age group, toddlers age group. In the infancy, when the child has started learning to walk, so they don't have the proper gait, so they will wobble and they will fall down. So that's why it is very important in the house if you have the mat, so that if the child will fall down, he will not get injury. Many times the children who has some kind of the disability with the muscles or the bone or any kind of the illness where they cannot balance, many times the pediatrician advise the helmet for them, so they will walk with the helmet, so if they will fall down, they will not have the serious brain injuries. What are the other things you can do at home to prevent the this kind of the head injury or the accidental injuries? So number one, always accompany the child. Like if you have kept like a 7-month or 8-month old baby over the bed, so if you are going somewhere, just take the baby to the ground and then you go. Otherwise child will flip from the bed and he will get injury. Okay. To be cautious, if you will keep the child over the bed and both the side on the floor, you keep a thick mattress. So even if he will fall down, he will not get much injury. Second important thing, when the child has learned to walk, support him and let him walk for the initially till he will have the proper gait. Accidents like the road traffic accidents, obviously when you are in the car, the seat belts are mandatory, so they should not have the very strategic and the faster movements, so that they will not got much head injuries. So friends, this is all about the head injuries. I have tried to give you the brief information about the head injury and how you can prevent. Still, if you have queries, questions, you can put in my comment box, and this kind of the educational videos I will keep on making, so that at least parents have the authentic and correct knowledge about what to do in different type of the situation. I will recommend to see the video which I have mentioned, that if the child accidentally ingest the toy coin magnet in the mouth, watch that video, because that is very important for the parents and we are seeing many cases like that, and many times the child has to undergo the surgeries, and those are the things are easily preventable, like the children put the magnet in the mouth and they swallow it. If there are 2 or more magnet, many times it requires the urgent surgery, but you can prevent it. Parents can take little bit more care and they can prevent it. Okay friends, that's all. If you like the video, share with your friends, colleagues, and if you are first time on my YouTube channel, subscribe as well. Thank you very much.